This film is about mental health, talking about it and listening to others.
Mental health is about our feelings, our thinking, our emotions, and our moods. Everybody knows how to look after physical health, but looking after our mental health is just as important because you can't see it, you need to talk about it.
Good morning, Afia.
Good morning, Miss.
Good morning, Kai.
Good morning, Miss.
Good morning, Jack.
Good morning, Miss.
Good morning, Alex.
Good morning, Miss.
Good morning, Sid.
Good morning, Miss.
Good morning, Sophie.
Good morning, Miss.
Good morning, Jay.
Good morning, Miss.
This film is all about Jay and us. We're her friends. We're all 10 or 11 years old.
All in the same school, live in the same area, but we're all very different to each other.
We all have different feelings every day. They come and go.
We can feel excited,
Silly. Angry. Nervous. Grumpy. Confused. Lonely. Happy. Confident.
These are small feelings that we all have every day. What can we do when small feelings are bothering us?
I like KFC, or I like going in the bath. I would probably write it down. You'll feel it's out of you and on the paper. I usually read a book, so I can just escape into the book and then my worries are behind me. When I feel stressed, I usually just turn the shower on and sing in the shower. Just like sit down and play on my favourite video game, really. You could count until you don't feel stressed.
Sometimes we can have big feelings and they don't go away. Big feelings can affect our mental health.
Big feelings can stop us getting on with our lives. They can change how well we feel, how we behave, how we see the world, and how we get on with other people.
Some of Jay's feelings stayed too long, and they got too big for her to manage on her own.
What's wrong with Jay? She's usually mature and good at getting her work done.
How are big feelings affecting Jay?
Am I in a jungle? Am I in the sea? My head is going crazy. Will you come and save me?
My tummy hurts. I can't get to sleep at night. I can't concentrate at school. It feels like I have a volcano inside of me getting hotter and hotter.
Sometimes it might help to talk to someone about our feelings, but it can be hard to find the right person.
Do you think your mum might know something's wrong?
My mum has her own problems. She's not very well. I've been looking after her.
What about telling Miss Evelyn?
She's always busy.
What about your sister?
I wanted to talk to her, but how could I say it?
Sometimes it can be difficult to know what to say.
Can I talk to you?
I've been having a really hard time lately. Please help me, I'm really struggling.
If someone wants to tell you something, how could you be a good listener?
If you're listening to someone, you can lean forward or sit side by side. Make them feel comfortable. Always listen to them. Give them your time and attention.
If you're a friend, you might not know what you could do, but you can help the person find an adult who can help.
Let's see how Jay got on.
Hi, I'm Jack. I don't go to school with Jay, but I go to swimming with Jay. It was me she decided to talk to, and I was worried about her. I told our coach because I thought she know the best thing to do.
I can see now that my problems are too big for me to deal with on my own. Other people have ideas and experience. There are lots of choices. I just had to think it through. Talking to someone didn't magic all the bad things away, but it did start to help me to change things, and it was good not to feel I was on my own. I'm 11 years old and I realized if I wanted things to get better, I just needed a bit of help.
If your feelings are getting too big to cope with on your own, talking to someone you trust might really help.
Of COVID-19, physical and psychological harm has been spreading across the global population alongside the spread of the virus. Currently, the coronavirus has spread to most countries in the world, and its impact on the public health is also increasing. Economic recession have negatively affected many people's mental health and created new barriers for people already suffering mental illness and substance use disorders. A pandemic is not just a medical phenomenon. It affects individuals and society and causes disruption, anxiety, stress, stigma, and xenophobia. Interventions were implemented during the pandemic here in the Philippines, such as nationwide lockdown, home quarantine policies, curfew hours, and school lockdowns. As the pandemic wears on, ongoing and necessary public health measures expose many people to experiencing situations linked to poor mental health outcomes. This meant a huge and sudden change of regular life. People might experience sudden separation from loved ones. Some encourage shortages of living supplies. And many people also faced great financial distress due to job closures and reduced wages. People's behavior may greatly affect the pandemic's dynamic by altering the severity, transmission, disease flow, and repercussions. The present situation requires raising awareness in public, which can be helpful to deal with this calamity. These perspective articles provide a detailed overview of the effects of the COVID-19 outbreak on the mental health of people. This brief explores mental health and substance use during and prior to the COVID-19 pandemic. It focuses on populations that were particularly at risk for experiencing negative mental health or substance abuse consequences during the pandemic, including young adults, people experiencing job loss, parents and children, communities of color, and essential workers. Young adults have experienced a number of pandemic-related consequences, such as closures of universities and loss of income that may contribute to poor mental health. During the pandemic, a larger than average share of young adults ages 18 to 24 years old report symptoms of anxiety or depressive disorder. Compared to all adults, young adults are more likely to report substance use and suicidal thoughts. Prior to the pandemic, young adults were already at high risk of poor mental health and substance use disorder, though many did not receive any treatment. Research from prior economic downturns shows that job loss is associated with increased depression, anxiety, distress, and low self-esteem, and may lead to higher rates of substance use disorder and suicide. During the pandemic, adults in households with job loss or lower incomes report higher rates of symptoms of mental illness than those without job or income loss. In addition to increased anxiety and depression, job loss may lead to other adverse mental health outcomes, such as substance use disorder. Households experiencing income or job loss reported that pandemic-related worry or stress caused them to experience at least one adverse effect on their mental health and well-being, such as difficulty sleeping or eating, increases in alcohol consumption or substance use, and worsening chronic conditions. To help slow the spread of coronavirus, many schools and childcare centers across the United States have closed and transitioned to virtual instruction for at least some time. With these closures, children and their parents are experiencing ongoing disruption and changes to their daily routines. Research during the pandemic highlights concerns around poor mental health and well-being for children and their parents. For example, many parents with school-aged children are now more concerned about their children's emotional well-being than prior to the pandemic. Both parents and their children have experienced worsening mental health since the start of pandemic, and women with children are more likely than their male counterparts to report worsening mental health. The pandemic's mental health impact has been pronounced among the communities of color, also experiencing disproportionately high rates of COVID-19 cases and deaths. Black and Hispanic adults have been more likely than white adults to report symptoms of anxiety or depressive disorder during the pandemic. Prior to the pandemic, Black and Hispanic people were less likely to receive needed behavioral health services compared to the general population. Additionally, deaths by suicide which may increase due to the pandemic, have historically been much higher than average among Native American communities. Essential workers during the COVID-19 pandemic, such as healthcare providers, grocery store employees, and mail and package delivery personnel, have shown high rates of poor mental health outcomes. These workers are generally required to work outside of their home and may be unable to practice social distancing. Consequently, they are at risk of contracting coronavirus and exposing other members of their household. A KFF analysis found that essential workers face additional challenges, including difficulties affording basic necessities as a result of the pandemic. These factors may contribute to poor mental health outcomes for these workers. In addition to that, as a high-risk group in direct contact with the virus, medical workers should be monitored and their mental health deserves extensive attention. A study conducted by the Frontiers in Public Health in year 2020 says that medical care personnel, as the backbone of the front line of epidemic prevention and control, have been taking on heavy work tasks with a high risk of infection and great work pressure. Healthcare workers, especially those in hospitals who take care of confirmed or suspected patients, are more vulnerable than the general population, experience a high risk of infection and negative emotional stress, and further risk spreading the virus to their family, friends, or colleague. Moreover, dangerous and susceptible environments as well as traumatic experiences caused by high exposure can all have a certain impact on an individual's emotional state and induce emotional stress responses, as well as severe anxiety and depressive disorders and post-traumatic stress disorder. A psychological survey published in the Lancet Psychiatry showed that the prevalence of depression, anxiety, insomnia, and stress among medical staff involved in the prevention and control of the epidemic were as high as 50.7, 44.7, 36.1, and 73.4% respectively. Both those newly experiencing mental health or substance abuse disorders and those already diagnosed before the pandemic may require mental health and substance use services but could face additional barriers because of the pandemic. The COVID-19 pandemic has disrupted critical mental health services in 93% of countries worldwide, while the demand for mental health is increasing, according to the new World Health Organization survey. The survey of 130 countries provides the first global data showing the devastating impact of COVID-19 on access to mental health services and underscores the urgent need for increased funding. The World Health Organization has previously highlighted the chronic underfunding of mental health prior to the pandemic. Countries were spending less than 2% of their national budget on mental health and struggling to meet their population's needs. Fear, worry, and stress are normal responses to perceived or real threats, and at times when we are faced with uncertainty or the unknown. So, it is normal and understandable that people are experiencing fear in the context of the COVID-19 pandemic. Added to that fear of contracting the virus in a pandemic such as COVID-19 are the significant changes to our daily lives as our movements are restricted in supports of efforts to contain and slow down the spread of virus. Faced with the new realities of working from home, temporary unemployment, homeschooling of children, and lack of physical contact with other family members, friends, and colleagues, it is important that we look after our mental as well as our physical health. The World Health Organization, together with partners, is providing guidance and advice during the COVID-19 pandemic for healthcare workers, managers, and people who are looking after children, older adults, people in isolation, and members of the public, more generally, to help us look after our mental health. These are the general factors how pandemic has affected our mental health. First is that we're anxious, depressed, and traumatized. Also, stress and anxiety fuels poor sleep, creating a vicious cycle. The more we lay awake at night during the pandemic, rehashing worries we have no control over, the worse our mental health becomes. Second, some of us are lonely but not all. Stay-at-home orders and social distancing have left many people isolated, so it makes sense that we would be feeling lonely. However, this hasn't been true for everyone. People who are younger or living alone or who have a chronic health condition are lonelier than other groups. Domestic violence has increased. In early April, the United Nations called for immediate global action to combat the increasing violence against women and girls during the pandemic. Needless to say, the threat of abuse is compounding the stress, anxiety, and fear that many people are already experiencing during the pandemic. The effects depend on your personality, lifestyle, and demographics. While older people have greater health risks from COVID-19, it seems to be younger people who are struggling emotionally. Younger people tend to be more depressed, anxious, stressed, and traumatized in the era of COVID-19. The same is true for women who may also be more lonely. For younger people, it could be the disruptions to the routines that are to blame, particularly for college students who had to adjust to online schooling. So, the more the pandemic was affecting people's daily lives, the more anxious they felt. Next is how the pandemic has affected our work. Doctors, nurses, and paramedics are taking on the urgent task of caring the COVID-19 patients, while other essential workers are putting themselves at risk to sell food, deliver mail, and pick up trash. Many office jobs have transitioned to remote work, asking employees to isolate at home, with many precariously juggling work and care for children or elders. Policy responses and considerations. Throughout the pandemic, leading public health organizations, including the CDC, SMHSA, the World Health Organization, and the United Nations, have released general considerations and resources addressing the mental health and well-being of both general populations and specific high-risk groups during the pandemic.
The current challenges brought about by COVID-19 for people all around the globe are unparalleled and have caused fear, anxiety, and uncertainty for so many of us. We are all going through this together, and it's important to understand that you're not alone in how you're feeling right now, and that there are practical, healthy ways to cope with these emotions. The COVID-19 pandemic has created unprecedented change and a need for a response from everyone around the globe. Many of us are worried about our loved ones and our livelihoods, and there is no one right way to cope with what we're experiencing. Remember, however you're feeling, there are others that feel the same. You are not alone. Here are a few voices of people struggling to cope during this time.
Some days I'm okay. I'm doing my best to adjust. But yesterday, I couldn't stop crying. This all just seems so unfair, and I feel so angry that this is happening to us. I'm struggling to care for my kids and work from home at the same time, and I'm worried about my parents' health. I watch the news and it just seems so hopeless. I don't know how to keep it together.
I feel so lost and sad. So much has changed. I used to have dinner every week with my family, but now I can't be in the same room with them. I really miss them.
I'm missing out on my prom and my graduation. I've literally been looking forward to these things my whole life, and I'm heartbroken.
With everything going on now, I just can't stop my thoughts. And physically, my chest hurts, and I can't breathe. I get nauseous thinking about what could happen to my family and my friends.
Before this happened, I used to worry all the time about getting sick. Now that worry has turned into absolute terror. My heart races every time I have to go to the store. What if I bring germs home with me? I can't stop washing my hands.
No matter how exhausted I am, my sleep is still terrible. I just keep picturing all the things that could possibly happen. Will I ever get a good night's sleep again?
I've been through so much already. I don't know how I'm going to deal with this too. My flashbacks are getting worse and worse.
Honestly, I feel like I'm more comfortable in times of crisis. I'm not sure why I don't feel as upset as everyone else does right now.
I don't know when or if everything is going to get back to normal. I feel like the weight of the world is on my shoulders. How many people are going to be affected? What does this mean for me and my family?
We've just heard some of the ways people are being affected by the COVID-19 situation. Here are some things that are helpful in building resilience during times of crisis and intense stress. There are a lot of things outside of our control right now, which can be scary. By focusing on the things we can control, we can refuel ourselves and become more grounded and able to focus and cope with all of the things we can't control. One of the most important actions within your control is to follow CDC guidelines to reduce your chance of being exposed or passing the virus on to others. Use social support. No one should go through this alone. There is absolutely no shame in talking about what you're going through with your friends and family, and it's important to be there for others too. Video chat and phone calls are a great way to stay connected. Prioritize self-care. Staying on a regular schedule, exercising, eating a healthy diet, keeping a sleep routine, and taking time to meditate or pray are all important, now more than ever. Be gentle with yourself. During times like this, you will have good days and bad days. Your emotions are most likely heightened at this time. Try not to compare your life to what you see on your friends' social media feeds. There is always more going on behind screens. Helping others can bring joy and gratification. Do what you can to help others, even if it's something as simple as lending an ear or making someone smile. Be kind to the people around you, especially the folks who are still out working, to ensure we all have what we need. If each day feels like an uphill battle, it may help to seek out professional support. To continue helping during this time of social distancing, many mental health providers are using telemental health in their practice. If you can't afford therapy or need to talk to someone right away, you can call the Suicide Prevention Lifeline 24 hours a day at 1-800-273-8255. You are not alone in how you are feeling. There are things you can do and resources you can use to cope during this challenging time.
We live in turbulent times and compacted by the COVID-19 pandemic. The issue of mental health is not only relevant but crucial. Mental health is more than the presence or absence of a mental illness. It is a crossroad between emotional, psychological, and physical well-being. This year, many people have faced serious challenges to their mental health, along with the health impacts of the disease. COVID-19 has led to self and social isolation, disconnection from family and friends, quarantine and lockdowns on movement resulting in more people than ever experiencing. Feelings of helplessness, isolation, grief, anxiety, and depression. Demand for health support services has increased exponentially as a result. To address these challenges and increase the capacity and availability of support, governments, local communities, and civic organizations need to increase the resources directed towards addressing psychological suffering now and after the pandemic has passed. Volunteering has been shown as one way to assist. Volunteering not only reconnects people and supports those who need help, it gives volunteers themselves a sense of meaning which can help counteract low mood and produce positive thinking. Many people around the world have responded to the pandemic through technology, volunteerism, and leaning on each other to bridge disconnection and improve mental health. The new reality of social distancing and other safety measures is testing everyone, and those living with mental illness may find this time even more challenging if the support system they rely on is not in place. Experts from the Department of Mental Health at the Johns Hopkins Bloomberg School of Public Health put together these tips and resources on how to protect your mental health during these trying times. As the coronavirus pandemic has unfolded across the world, ordinary life has been put on pause. Lockdowns, travel restrictions, school closings, work closings, and social distancing have created a level of social isolation previously unseen across the globe. Fears about finances and food shortages have placed additional stressors on an already anxious and sensitized population. The practices recommended by the Centers for Disease Control and Prevention and World Health Organization are necessary and designed to protect the community, particularly the most vulnerable individuals. However, this pandemic and associated changes, including serious financial implications for many households, can have profound consequences for our mental health. Traumatic or stressful experiences put individuals at greater risk for not only poor physical health but poor mental health outcomes, such as depression, anxiety, and PTSD. You may notice that yourself or others around you are more edgy, irritable or angry, helpless, nervous or anxious, hopeless, sad or depressed. Sleep may be disrupted and less refreshing. Practicing social distancing may leave you feeling lonely or isolated. If you are at home with children, you may have less patience than before. Those who are especially vulnerable to COVID-19, older individuals and people with medical comorbidities or immune-compromised systems who need to be especially stringent in following guidelines from the health authorities, may be the very people whose mental health may suffer the most. Individuals with a pre-existing mental health condition such as an anxiety, disorder are also at the heightened risk for poor mental health outcomes as a result of coronavirus. It is important that as a population, we learned how to protect our mental health during this stressful and ever-changing situation, while also following the guidelines set by the health authorities to protect our physical health. Here are some strategies that can be used during these challenging times to protect your and others' mental health. Number 1 is create structure. Create a daily schedule for you and your family. Feelings of uncertainty can lead to increased mental health symptoms. Try to limit the amount of time you spend watching, reading, or listening to the news. Get your information on the coronavirus outbreak from a trusted source such as the CDC or World Health Organization, once or twice a day. Make space for activities and conversations that have nothing to do with the outbreak. Number 2, maintain your physical health. Protect your sleep. Good quality, sufficient sleep not only helps to support your immune system, but also helps you to better manage stress and regulate emotions. Adults should aim for 7 to 9 hours, while children and teenagers need even more. Try to eat at regular times for nutritious foods whenever possible. Some people may crave junk food or sugary snacks and be tempted to snack mindlessly when stressed or bored, and others may skip meals altogether. Maintain an exercise routine. Even if you can go to your local gym, exercise at home using an online workout video, or go for a walk, run, or bike ride in a sparsely populated area. Number 3, support and create your community. Create a virtual support group and check in with those around you. There are many options for connecting, including video conferencing software such as Google Hangouts and FaceTime. During this time of isolation, connecting face-to-face is more important than ever. If you can stream, then calling and texting is important. Crises offer a time for community cohesion and social solidarity, and volunteering is one way not to only help others, but yourself as well. Science has repeatedly shown that volunteering can improve mental health. If you have children, talk to them honestly about what is going on in an age-appropriate manner. Help kids express their feelings in a positive way, whether playing in the backyard, drawing, or journaling. Number 4, take care of your spirit. Find a place of worship that is steaming or recording services. If praying is an important part of your life, make it time for it. Stay connected to your church community through phone calls, emails, and video chats. Try meditations, deep breathing, progressive muscle relaxation, or another mindfulness relaxation technique. Consider enlisting friends and family and practicing meditation together at least once a day. Mindfulness can help lower blood pressure, reduce stress, support your immune system, and protect your brain health. Number 5, continue or seek out mental health treatment. If you are currently in mental health treatment, continue with your current plan if possible, being mindful of approaches to minimize contact with others. Consider teaching out to a mental health professional even if you haven't before. Make sure you have ongoing access to any medications you need. Ask a video, therapy, or phone call appointments. Most states have already made emergency exemptions to insurance coverage for telehealth. Regulations have been temporarily relaxed to allow even non-medical software like Skype, FaceTime, and Zoom to be used for telehealth. Even if this option wasn't available with your provider previously, it may be now. Avoid drugs and alcohol, particularly if you have a pre-existing mental health or substance use disorder. The need for social distancing may make it difficult to see symptoms of depression in others. In hunker-down mode, the in-person opportunities that we usually have to notice that friends, family, and colleagues may be struggling with a problem are no longer there. One way to think about it is that child abuse or intimate partner violence is missed more often in winter because long cloths cover bruises. Conduct regular check-ins with your network and stay tuned to symptoms of depression, such as persistent feelings of sadness, hopelessness, loss of interest or pleasure in activities, or changes in sleep and weight. Remember that the emotions you may be experiencing are normal reactions to difficult circumstances. Accept that things are different right now and everyone is adjusting. Prioritize what is most important and know that it's okay to let some things go right now. Be kind to yourself and others. Try to stay positive and use this time to spend more time with your children or spouse. Try things you've been putting off, such as taking an online class, learning a new skill, or getting in touch with your creative side. It can be hard to think past what is going on today, let alone in a week or in 6 months. But give yourself permission to daydream about the future and what is on the horizon. Remember that this is temporary and things will return to normal.
So, good day to everyone. My name is Jason Boyanday and I will be discussing our session 4 entitled Mental Health. So, these are the tips on how to cognitively healthy. First, we need to get physical exercise. Research showed that using our muscle also helps our mind. Exercise regularly increase the number of tiny blood vessels that bring oxygen-rich blood to the region of the brain that is responsible for thought. Exercise also spurs the development of new nerve cells and increase the connections between the brain cells. The next is get plenty of sleep because sleep have an important role in our brain health. There are some theories that sleep helps clear abdominal proteins in our brain and it consolidates memories, which boosts our overall memory and brain health. It is important that we must try to get 7 to 8 consecutive hours of sleep per night. So the next is stay mentally active. It shows that mental decline is not an interval part of aging. People who lead intellectually stimulating lives are more likely to be free from dementia conditions like Alzheimer's disease. There are so many things that we can do to keep our brain in shape, such as doing crossword puzzles, Sudoku, playing cards, or putting together a jigsaw puzzle and others that can make our habits or our interests. Adopt a growth mindset. In adopting a growth mindset is believed that we can improve our abilities and capabilities and create a success through continuous learning, practice, and persistence, openness to new experience through traveling, painting, photographing, and others that can make us an even better person. And also learning a new skill or taking something that can show improvement to cognitive function. Have also the emotional well-being. In emotional well-being, our emotional well-being has been shown to influence our health in many ways, including the health of our brain. Stress, anxiety, and depression, when prolonged, have been all shown to take a toll cognitive function, leading to impaired memory of cognitive decline. So the next is improve our diet. Good nutrition can help our mind as well as our body. For example, people that eat a Mediterranean style diet that emphasizes fruits, vegetables, fish, nuts, unsaturated oils, and plant sources of proteins are less likely to develop cognitive impairment and dementia. Avoid tobacco. Avoid tobacco in all its form. Smoking is harmful to our body and to our brain. It raises the risk of heart attack, stroke, lungs disease, and others. Quitting smoking at any age can improve our health. So we have also the care for our emotion. People who are anxious, depressed, sleep deprived, or exhausted tend to score poorly on cognitive function tests. Poor score don't necessarily predict an increase of risk of cognitive decline in old age, but good mental health and restful sleep are certainly important in our health. So we have also the care for our emotions. We need to care for our emotions because people who are anxious, depressed, self-deprived, or exhausted tend to score poorly on cognitive function tests. Poor scores don't necessarily predict an increased risk of cognitive decline in an old age, but good mental health and restful sleep are certainly important goals in our health.